Hello, I'm Adam.
Hi, and I'm Chris.
And we're from Concordia University, Wisconsin's Occupational Therapy Department.
For those of you who are unaware of what occupational therapy is, we focus on helping individuals in those activities are involved in a daily routine. So examples would be getting dressed, going to the bathroom, going to work, doing some yard work, taking care of your pets, and hanging out with your friends. So a couple examples where you could see occupational therapists working would be at the hospital, veteran affair facilities, ergonomic programs, so work hardening or work conditioning, outpatient facilities, and community health programs. So Adam, what are we going to talk about in this video?
Funny you should ask, Chris. In this video, we're going to talk about some of the outpatient services that occupational therapists provide to our clients.
Before we show you some of the cool things that occupational therapists get to use in an outpatient setting, first let's talk about some of the conditions that we typically treat.
Some of these conditions include TBI, stroke patients, cumulative trauma disorders such as carpal tunnel syndrome or cubital tunnel syndrome, and post-surgical orthopedic procedures.
So now we're going to talk about some of the assessments you would typically see in an outpatient setting. So, sensation. Do you feel hot or cold?
Hot.
Intact. Here, you might see box and blocks. So with this, we're looking at hand dexterity and how that carries over into its functional use.
Nice demonstration, Chris. Occupational therapists use goniometers to measure the amount of range of motion at a joint. Chris, can I try it on you?
Yeah.
Hey, can you bring your hand up to your shoulder? Looks great. Occupational therapists also use hand dynamometers. Hand dynamometers help us record the grip strength in a particular individual's hand, which can help us determine the functional ability that they will have holding on to objects. Squeeze, 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 squeeze. Wow, you're strong. Let's talk about a few other assessments that you might see in the outpatient setting. Chris, let's try MMTs. Can you hold this for me?
Mm-hmm.
Hold, 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 hold. That's a 5. Chris, can you have your arms up for me, please? This is called the bruise test. Do you feel any numbness or tingling?
Sure don't.
That means you're negative for thoracic outlet syndrome.
So now we're going to talk about some of the treatments that you might typically see in an outpatient setting. One of them being kinesiotape. Now this may be used to help facilitate muscle contraction or muscle relaxation. We might also see this being used to reduce edema or pain.
Another treatment that occupational therapists utilize is ultrasound, which can be used in many different ways. One way it can be used is to heat up the tissues to provide tissue extensibility. It can also break up scar tissue to help reduce the possibility of contracture. The majority of these treatments are utilized to facilitate engagement in functional activities. For example, cup stacking.
We appreciate you taking the time and watching our informative video.
Hopefully you have a better understanding of some of the services that occupational therapists provide in the outpatient setting.